How to interpret muscular dystrophy, genetic test results. Imagine getting a genetic test result and wondering what it really means for you or your loved one. When it comes to muscular dystrophy, especially Duchenne and Becker types, understanding these results is key to diagnosis, management, and family planning. First, a positive genetic test showing a mutation in the dystrophin gene confirms a diagnosis of dystrophinopathy. This is especially true if clinical signs like muscle weakness and high serum creatine kinase levels are present. The test looks at your DNA, usually from blood cells, to find mutations that cause these conditions. Most often, the test detects large deletions in the dystrophin gene, which make up about 70 to 80% of cases. It can also find large duplications, around 7%, and smaller mutations like point mutations or microdeletions, especially with advanced sequencing methods. Knowing exactly where and what kind of mutation you have helps predict how the disease might progress. For example, mutations that disrupt the reading frame of the gene usually cause the more severe Duchenne muscular dystrophy. If the mutation keeps the reading frame intact, it often results in the milder Becker muscular dystrophy. This information helps doctors estimate prognosis and plan treatment options. Some treatments are designed to target specific mutations. For example, exon-skipping therapies and gene therapies are tailored to particular genetic changes. So, identifying the exact mutation can open doors to personalized treatment options and eligibility for clinical trials. For family members, especially female relatives, genetic testing can determine if they are carriers. Carriers might not have symptoms but can pass the mutation to their children. Knowing carrier status helps with family planning and reproductive choices. If initial testing does not find a mutation but clinical signs strongly suggest muscular dystrophy, further testing with sequencing might be needed to detect smaller mutations that are harder to find. Sometimes, a muscle biopsy is still necessary if genetic testing doesn't reveal a mutation, but nowadays, genetic testing is usually the first step because it is less invasive and provides detailed information. In summary, interpreting muscular dystrophy, genetic test results involves understanding the type and location of the mutation within the dystrophin gene, how it affects the protein, and what that means for diagnosis and treatment. Always work closely with healthcare professionals who specialize in neuromuscular genetics to get the most accurate interpretation and personalized care. Remember, each person's situation is unique, so medical advice tailored to your specific case is essential for the best outcomes.